today we are going into probably most exciting parts of this practice, and we're going to address intraoral and buccal massage. Why are we doing intraoral? What brought us there? Why, like, so many people write to me, why do you have to go inside her mouth? And I cannot explain this to everybody, but I'll explain it to you. So intraoral buccal massage, as we know, as we've been told, herbicide, it was discovered in France in 1960s. This is not true. Intraoral buccal massage was done by Egyptians in the Pharaoh era, and it used to be called Ka massage. Ka. In 1960s, in France, it was remembered in a way, not even rediscovered. It was remembered and brought it to the big West public. So it's not as new as 1960s. It's been done by centuries, then people stopped doing it, forgot about it, and then it was brought back to us. Why do we need to do it? Why? For years we didn't do it, and then we started to do it. And if you will see the results from facial massage, every time we perform massage on a client, on ourselves, it's for one reason only. It's to rejuvenate the face, relax the muscles, make face looking more youthful, and to bring health to the tissues via blood circulation, right? Every time, if you're going to take a face, the person, you're going to put next to each other, facial that's been performed with excellent topical massage, and face that been performed with a topical plus intraoral massage, the person who received intraoral massage is going to look younger, plumper, and more rejuvenated. Why? Because of architecture of the face. So this is the architecture of the face and trajectory of aging face. Now, this picture that I picked is exaggerated form. So the trajectory of the aging is this way. Everything gets stuck. Like Nicole, you noticed it on your model yesterday, right? Everything gets stuck, pushes in. That's why you had to do this thing to move it outwards, in and downwards. And this is the architecture of the face. This is how we age. Our bones get shrinking. Our soft tissues are falling. They sit on top of each other, and this is how we age. So we kind of almost like collapse. No matter what you're going to do from outside, Nicole, you tried yesterday. This was a very good example. You tried yesterday to do this and then this, right? It's still not going to be as effective as when you're going inside the mouth of your client, person mouth. Why? Because when you go inside the oral cavity, you have opportunity from inside to give space inside the mouth. Most people think that intraoral massage is done to relax the masseter or the chewing tendency in the muscles. It's a very small part of it. In fact, you can relax masseter from outside also. Most of the time, the biggest reason we go inside the oral cavity of the person is to create a space inside the oral cavity, to recreate dimensions that that person is losing over time. Once you start creating the space, and you will see, once you're going to be practicing step by step, you will see what to do. First, you go inside the mouth and you investigate. First, you need to see what is going on inside there, where the lock is. Sometimes you're going to go into a person's mouth, you're going to start pushing right on the chin part, and literally her muscles, involuntarily, she has nothing to do with it, muscles are going to start to push you out of her mouth. They are that contracted. This age, as we grow older, we have less and less space inside the oral cavity. When you go inside and you create that space, you opening the space. First of all, the people will tell you right away. That's exactly what they tell you. And ask people, you'll ask, how do you feel after the buccal massage? Definitely, girls, whoever is going to watch it in recording, because in this course, most people watching recording, Ask your clients, how do you feel after buccal? And they will tell you, I feel like I have more space inside my mouth. So what are you doing? You are rewinding the damage. The job of age is to collapse it. Your job is to recreate the space. The job of age is to collapse it. Your job to go and recreate the space. And once you go inside the oral cavity and you create that space and you bring the blood circulation to tissues that didn't have blood circulation in years, you will see what happens to the face right away after one treatment, 1 hour treatment. Everything comes out. In addition to creating the space, of course, you relax masseter muscles, and actually you don't have to push on masseters as hard once you have them gripped from both sides. It's one thing when you go after masseter from only topically, you have to go a little deeper. But once you go inside the mouth, masseters between your fingers, you can manipulate it and relax it without putting a lot of pressure. And of course, you relax the chewing tendons. Now, people will come to you and ask you, oh, I have TMJ. Can you help me with that? We cannot tell them that we can. We can only tell them that we're doing it for rejuvenation purposes only, right? But in fact, of course we do, because if we're not going to relax the contraction, we're not going to be able to provide them with the lift. So we have to relax that contraction. Again, Nicole, yesterday on your model, you experienced it. And this is the trajectory of human aging on a face. Architecture of the face literally collapses. When we are young, we have a lot of space in the face. We have a lot of subcutaneous fat tissue, the beautiful fat pads. Our bone hasn't lost its volume just yet, and we are nice and lifted. With age, bone shrinks, subcutaneous fat tissue migrates, we lose space inside the oral cavity, and we collapse. So what do we do in this practice? We go against the trajectory of aging. We are restoring the space. One of the most important things that I need you to remember, when we work inside the mouth, we work very carefully with very light hand. Why? Because let's say the client comes to you and she already has pain and discomfort in her mouth because she clenches her teeth, right? Especially they do it during night. And a lot of people need to wear retainer during the night, but they don't do it. And they're like this. In fact, all the muscle contractions during the sleep happens even more than during daytime because it's stuck in that mask of collapse, right? So she comes to you and she tells you, I have so much pain. I cannot chew. My face always feels tense. Can you help me with TMJ? Well, as I told you, you have to tell her, well, we work for looks only. However, when you're going to go inside her mouth and you're going to start working correctly with a very light hand, she will feel instantaneous relief. So although we cannot tell them that we can help them with our words, we can definitely help them with our hands, right? So I always answer, you know what, I'm not a doctor, I'm not here to bring any pain relief. However, I can do it for aesthetic purposes only, and let's see how you will feel. And in the end of the facial, they say, I feel like pressure being taken off my face, like I have space in my mouth, like I can breathe easier again, like I can stand easier again. I feel like I don't have pressure in my head. So all those things we can do by relieving that pressure, that contraction for aesthetic purposes only. When you're gonna go inside the mouth, in some people, you're gonna feel quite a soft chewy tendons. And some people will feel like great wall of China. They're gonna be so contracted, you're not gonna be able to put your fingers in. In that case, what I need you to do, and we will talk about concentration a little later, but just for you to know, as a rule, the more contracted muscle is, the lighter is our hand that we apply on her, and the longer time we take. Never take more than 15 minutes though for a buccal massage. 15 minutes is plenty for buccal massage. Then you over processing the tissues from inside and she may feel uncomfortable. We don't want to do that. But if she comes to you and she has a severe contraction, put your fingers inside her mouth and just stand there. And after you will feel underneath your fingers, you actually will feel that she's releasing the contraction. Then you can start vibrating. But those are for severe cases. Now, it's counterintuitive not to press hard on a muscle that's very contracted. But this is what's happening in reality. If muscle is contracted, there is already inflammation, right, in the tissues, because we know that what happens to any injury, and that kind of contraction muscle is definitely injury in a person's face. When you get any injury in a human body, the first thing what goes there is lymphatic fluid to create a pad around that space. Inflammation. Unfortunately, what happens when you have inflammation? That space develops fibrosis. What you felt yesterday, Nicole, is probably was that contracted tissue, fibrosis. Fibrosis are like a glue on the face. They start pushing in, and you have a subcutaneous tissue migration into lower third part of the face. So ptosis, collapsed muscle, but there is not only collapsed muscle, there is also subcutaneous tissue migration. So on a different level, the host of things that can go wrong goes wrong when there is a contraction, because we have inflammation. Inflammation causes fibrosis. Fibrosis causes ptosis. Ptosis causes subcutaneous fat migration. So there is a chain of events that's going on when we have contraction in our chewing tendon. And that's why right after first facial, you see the difference, because we're removing that trigger for those chain of events. And of course, she's not going to look 20 years younger, but she's going to look significantly lifted and significantly younger after first treatment, if it's done right. Unfortunately, intuition wants to go strong on something that is blocked. As an esthetician, you're going to go into this locked tissue and you're going to want to work hard on it. This is the last thing you need to do. Soft hand, long time. Spend 15 minutes relaxing her tissues. Don't stay in her mouth for more than 15 minutes. Let's say you're going to go inside her mouth. I'm talking about very severe cases right now. Most people don't have those severe cases, but it's the severe cases that we have to be the most careful about. So you went inside her mouth, you investigated, then you went inside with a big finger straight to the corner of a chewing tendon. You put your finger on top of it and you feel like it's unmovable. You don't even feel the soft tissues in there. All you see, it's a hard partition, like division in here. In that case, put your hands in, stand there. Put the warmth, as I told you, we're going to talk later about it, into your fingers and then start vibrating. The more contraction, the more stagnating tissue, the more locked tissue you will be able to release to create space in there, the better she's going to look as an outcome, the better she's going to look in the end. So why buccal massage is so important? Because buccal massage can provide for you the results just topical massage cannot. You're not going to be able to create space inside the oral cavity just with topical massage. Topical massage is also very important. I mean, we stimulate fascia and blood flow and stretching. There's so many things, but one thing we cannot do with topical massage is to create the space in the oral cavity. And that is a very, very important part. So far, any questions?
Just a quick question. Can you explain ptosis a little bit more?
Ptosis, of course. So basically, ptosis comes as a result of fibrosis. Let's start from the beginning. We have a contraction. When we have contraction, we have injury, inflammation, right? So far, step number one, step number two, because everything is changing. When we have inflammation, we have fibrosis. What is fibrosis? Overproduction of collagen and other extracellular matrix that forms glue-like material that glues the layers of soft tissues together. So far, we understand, right? Nicole, so far? You get it so far, right? Because I need to go step by step for you to really clearly to understand that. So now we have fibrosis. Fibrosis is something that sticks the soft tissues, the layers, because we have so many layers. And what we don't take into consideration very often, that space between layers is also a layer. The space between layers allows the production of the healthy blood flow. Blood delivers to tissues nutrients and oxygen, vital for healthy function of muscle, fascia, all the tissues, bone, everything, right? So space is important. Now, so we have inflammation. Inflammation gave us fibrosis. Fibrosis glue everything together. The muscles around that area that's been glued are not fed anymore by blood flow. They cannot function in the optimum form. So you know what they do? They collapse. The collapsed muscle that cannot stay in the space by itself and support itself, the muscle that fell is ptosis, is ptosed muscle. Ptosis is a falling of the soft tissues, of the muscle fibers, really. Those are the ptosis. What do we do to reduce the ptosis? We cannot do it by itself. We need to go back to the cause, to epicenter, to original place where stagnation has happened. Release that place. Bring back the blood circulation. Blood is life. And muscle gonna be fat again, and you will see it's gonna replump again. Now we help with ptosis, right? Nicole, did I explain it in a way that you understood?
Yes, thank you so much.
Any additional question to that subject?
Not for me.
Not for you. Okay, Dania.
I'm fine, thank you, Helena.
So ptosis really, in short, it's collapsed muscle. That's it. Muscle that doesn't support itself. That's in short what ptosis is. But ptosis never come by themselves. They are an effect. The cause is stagnation of the tissue. Tissue where blood doesn't go. That's why it's very important. We address every layer of the face, of the soft tissues, of the build of us, but we forget about space. And space is where extracellular matrix is. Your glycoproteins, in fact, are in space. Your hyaluronic acid is in space. Like if you took, hey, we're gonna have a Zoom for the skin. It's next week, in fact. But if you look, it's very easy to understand. If you look at the skin, if you look at the dermal layer, right? Dermis, no epidermis, then we have subcutaneous. In the middle, we have dermis. In the dermis, we have a collagen fibers and elastin fibers. They're like a building blocks. And in between is a space. And in that space lives our hyaluronic acid and glycoproteins, right? So when skin looks really bad, crinkly, the space, the collagen and elastin fibers have collapsed, the pillars have collapsed, there is no space anymore. And hyaluronic acid and glycoproteins cannot live there anymore because there is no space. The same thing, the same exactly structure you can apply as the skin is constructed, right? You can apply to the face, the tissues of the face layers. It's exactly the same structure. If you want correct function of the tissue, if you want to avoid ptosis, stagnation, then you have to consistently maintain space. So everything we're doing here to unstagnate tissues and create the space. Young people, they have a lot of space. Older people, as I said, we collapse and everything goes falling on top of one another. So our job as professionals is to open them. And remember the first thing we did, we were making space in our chest, is to make a space. And the reason we do the lymphatic drainage first, because first we want to remove all the excess fluid, we're going to have easier time create. And the second thing we do, we go straight to create the space, to bring the blood flow, to deliver nutrients, to deliver oxygen. So you're re-engaging literally the function of a healthy dash youthful tissue, because youthful tissue is a healthy tissue. So you're recreating, you give an opportunity, you're recreating the conditions for the soft tissues to function optimally again. You bring in blood to them. You're recreating the conditions to work on optimum level, and you right away see it on a client's face. Because face is very, I mean, all the tissues, body, face, very responsive. So you're going to see it right away.